Okay, this is Brooklyn, and she's a staffy cross that has had problems with both knees. At the moment she has just ruptured her cranial cruciate ligament on the right hand side, and she's quite lame on this right hind leg at the moment. On the left side she has previously had a rupture of her cranial cruciate ligament, and she's had a procedure to correct that rupture called a TTO, which is a stabilisation type procedure. So she's had an operation on this right leg. It's gone well. She did have some trouble post-operatively and became a bit sore in this knee, and this was approximately 6 months ago, and she was treated with a stem cell treatment in the left knee, and that helped her a lot, and she actually went really well on that side. Subsequent to that, she's ruptured her right cruciate ligament, and it's not uncommon for dogs to have a rupture on one side and then followed at some stage in the future by another similar problem on the opposite side, and that's what's happened with Brooklyn. So at the moment she's really quite sore on this right hind leg. So this is the model of a knee, and we have the tibia and the femur here, the kneecap sliding in the trochlear groove, and the patellar ligament. I'll just remove that so you can just see a little clearer. There are two, this is the tibial plateau, and there's a ligament which arises from the cranial portion of the tibial plateau, and it goes to the back of the intercondylar notch on the femur, and that's the cranial cruciate ligament. And there's another one which arises from the posterior part of the tibial plateau and goes forward. So they're crossing over inside the knee, and Brooklyn's ruptured her cranial cruciate ligament. That's the one that's going in this direction, and she has a thrust and a draw sign, which is an instability that is associated with the rupture of that ligament. Very, very common problem. She's unfortunate to have both happen to her about a year apart, and today we're going to fix the right hand side cranial cruciate ligament problem that she has. Okay, so this is her her right leg, and she has instability with, she's got a draw sign, so that means that her tibial plateau slides forward underneath her femoral condyles, and so she feels like her knee doesn't work properly. And she also has another type of instability which is called thrust, and so if I flex her hock I can just get this advancement of her tibial crest there, and that's quite a significant type of instability for her. So that's how you diagnose a cruciate ligament rupture.